This last video is an introduction to bronchoscopy at the Indianapolis VA. So we do bronchoscopies in two different places really. We often do our inpatient bronchoscopies in the Bronch Suite, which is on the 8th floor, C wing in endoscopy. We also will sometimes do inpatient bronchoscopies in the MICU. This is rare, but what will happen is we'll have a consult patient that needs a bronchoscopy either urgently or semi-urgently, and there isn't room in the Bronch Suite because it's already scheduled out for the day or the next couple of days. In those situations, we can move a patient to the MICU to an open bed and complete the procedure and the recovery, and then move them back to their bed outside of the MICU thereafter. Our outpatient bronchoscopies are all done in the Bronch Suite. This gives you a detail on how to arrange an inpatient or outpatient consult bronch. So you would, in CPRS, go to the Consult tab, enter a new consult in the Pulmonary section, go to Pulmonary Staff, and then Bronchoscopy, and then as appropriate either inpatient or outpatient bronchoscopy consult. Fill out the electronic form and sign the consult and orders. Once you've gotten into the template, you'll find that you need to make some other decisions. You have to decide on whether you want to do moderate sedation with your attending or anesthesia sedation or general anesthesia. So you're aware anesthesia will help us with bronchoscopies on Monday afternoons, Tuesday, Wednesday, and Friday. You also need to make sure if you need pathology, for example for an E-bus, that they will be available. They have a similar schedule to anesthesia, but you must start the bronchoscopy before noon for them to help you. Work with your attending to figure these things out so that you can put in the appropriate needs when you're writing the consult order. These consults do go to Benita electronically, and she takes them off, but it's best to call Benita so that she can work on getting the bronch schedule for the right time and day for both you and your attending. If Benita is off, call Sarah, and Benita in the end, or Sarah if Benita is off, will send an email to all the involved services with date and time of the bronch. As far as preparation for a bronch, if you'll be doing it in the bronchoscopy suite, you'll need to complete a moderate sedation H&P note and the orders contained within that note on the day of the bronch and before the procedure. The note at the end of it includes an order set that allows you to order the saline, epinephrine, lidocaine, and any sedation orders that you need. If anesthesia is running the sedation for your bronchoscopy, you will only need to order the bronchoscopy immediately related meds like saline, epinephrine, and lidocaine. If, on the other hand, you and your attending will be sedating the patient, you will also want to enter the orders for sedation meds. Generally, these will be midazolam and fentanyl, as anesthesia is the only physician allowed to use propofol for sedation at the VA. Next, you'll want to complete the informed consent, and subsequently the bronchoscopy nurses will proceed if you've completed both the informed consent and the moderate sedation H&P, and that moderate sedation H&P is co-signed by your physician. They'll proceed with preparing the patient for the bronchoscopy. Other things that you need to worry about when you're preparing for a bronchoscopy is making sure that the patient is NPO, making sure that they have coags and platelets checked, and holding any necessary drugs. As far as completion of documentation for your bronchoscopy, you'll want to make sure that you enter all the orders for the tests for all your samples, including pathology, cytology, and the various infection workup labs that you want. You'll also want to write your note. To write your note for bronchoscopy, you'll go to New Note, Bronchoscopy Consult Result Note. You will then connect the bronchoscopy consult result note to the consult order that you entered earlier. If you are doing a bronchoscopy in the ICU that did not have a consult entered for it, then there will not be a consult to link to. In those cases, you'll use the bronchoscopy report or bronchoscopy note in CPRS to complete the note. Your note really should be completed and signed before you leave the bronchoscopy suite. For ICU bronchs, you'll want to call the RT assigned to the MICU. You can find the phone number in the survival guide, or if she's available, call Mary Centers. As far as overnight bronchs, there will not be a bronch tech on call, and the night shift RT is the assistant that will help you set up the bronch cart and complete the bronchoscopy. Thank you again, and enjoy your time at the VA.